My name is Kanako Fukuda. I'm an assistant professor at Utsunomiya University in Japan. The topic of the presentation is teaching practice to promote concept formation in a toddler with blindness. Instruction of appropriate hand movements using teaching materials. First, an introduction. In early childhood, children form concepts through activities in which they manipulate objects through their own hands. This is also true for blind children. Sighted children naturally receive information from their surroundings through their vision. However, blind children don't receive visual information, difficult to get information about surroundings, and it's hard to be interested in things in the outside world. This causes delay in the development in exploratory behavior and hand movement. It is important to encourage blind children to be interested in the outside world and to use their hands. For this purpose, we need materials and environments that are easy to understand through haptic perception. We carried out the teaching practice of appropriate hand movements with one blind toddler using teaching materials. This presentation reports on the course of 4 years of instruction from intake to elementary school entry. The target child was a boy. The period of instruction was about 4 years, from 1 year and 10 months to 6 years and 1 month. The diagnosis was level congenital blindness. His visual function was light vision. Developmentally, his verbal expression and understanding were age-appropriate. In terms of language, there were signs of understanding only words without experience. There were delays in hand movements and activities of daily living, and the exploration of both hands was not sufficiently developed. The next is teaching method. Educational consultation was conducted once a month for about 1 hour at the clinical room of university. We gave verbal warnings while touching the materials to the target child's hands and taught him how to play by taking his hands from behind. The next is analysis method. 4 years of educational consultation activities from intake to the start of elementary school, a total of 24 sessions, was divided into 5 periods from the perspective of the following stage of typical development. It is summarized in an A4 table. The vertical line in the table are the columns for each developmental stage. In the horizontal lines, there are the standard passage age for children with typical development and the age of the target child, and the pictures of teaching tool divided by activities, and at the bottom, changes in the use of both hand and tactile perception. I will explain each activity period. First, sensory motor activity period. The child notices objects in the external world and performs sensory operations such as reaching, tapping, and shaking. Secondary, in and out activity period. With the establishment of means-object relationship, children begin to use their hands for purposes. Thirdly, discriminative activity period. In this stage, the child will be able to imagine rotating in one direction. Fourth, framed block construction activity period. This is a period when comparative concepts such as large and small are acquired. In this period, construction activity becomes possible. Fifth, free construction activity period. Understand the two-dimensional direction of vertical and horizontal, And if there is a horizontal axis, understand the diagonal direction. Next is classification of teaching materials and tools. The teaching materials and tools used in the activities were classified and organized according to the following 7 developmental perspectives. First, sensory motor activities. Activities using teaching tools that emit light, sound, or vibration by pushing, moving. For example, light moves, music box cars. Secondary, in and out activity. Putting objects in holes and taking them out of bags. For example, puzzle boxes put in the cylinder. Thirdly, put and pulled out activity. The activity is that involve inserting and removing cylinders from a rod using both hands in cooperation. For example, disc plugging, bead threading. Fourth, discrimination activity is activities to discriminate shapes and size. For example, shape puzzle, discriminative cylinder block. Fifth, framed block construction activity. It's a construction activity that is framed on a planar axis. For example, numerical rods, puzzle with frames. The sixth is free construction activity. Among the construction activities, this is a three-dimensional, unframed. For example, blocks, cubic construction tasks. The seventh is tactile movement controlled activities. These are activities unique to blind children in which they control their hand movements and raise line with their hands. For example, tactile figure with raised line, tactile maze. Next, I will introduce the teaching process. Table 1 shows the teaching materials with the 7 activity perspective on the vertical axis and the teaching period on the horizontal axis. I would compare the age of typically developing child to the age of the target child. In this way, first is sensory motor activity period. In typical children, this stage is birth to 10 months, but our target child was from 1 year and 10 months to 2 years and 4 months after intake. Second is in and out activity period. In typical children, this stage is from 10 months to 1 year and 6 months, but the target child was from 2 years and 5 months to 3 years and 5 months. Thirdly is discrimination activity period. In typical children, the stage is from 1 year and 6 months to 2 years and 6 months, but the target child was from 3 years and 6 months to 4 years and 4 months. Thus, until the age of 4 years and 4 months, there was a significant delay from the typical development. On the other hand, at the age of 4 years and 5 months, the child was able to perform various activities. And after the age of 5 years and 6 months, he rapidly became capable of deep thinking activities. Next, I would like to explain about cognition and hand use in each activity period by showing you video of an activity. First is the sensory motor activity period. When the child first came for consultation at the age of 1 year and 10 months, he plays with only one hand on the right moves and the megaphone. With the Paro toy, he had trouble pushing the ball in. There was a difference in interest and hand manipulation skill. Here is a video of an intake at 1 year and 10 months. The child hears the sound of the right move. Teacher says, let's push together. But child says, I don't. Child says, I don't need. he's smiling. And then he happened to touch a toy. Child said I did it. He was pushing the toy himself. While playing the megaphone, the teacher introduced a toy called Paro. When he shows interest in Paro, the teacher quickly moves him from the floor to his desk. The ball had fallen. He was surprised. He said one more. The teacher said give it means press or push in Japanese. Next is in and out activity period. At the age of 2 years and 5 months, the child began to use both hands for familiar tasks, but only one hand was used to insert the cylinder. At the age of 3 years and 1 month, the child began to use both hands in the insert the cylinder, but the two hands were not separated. At the age of 3 years and 5 months, there was a budding of cooperation between the two hands. Here is a video of 2 years and 5 months old playing with Paro. It's cylinder pudding. He put in with only right hand. Teacher said, let's explore the hole. Child want to change the toy. This was a little difficult for him. We changed the toy to ball dropping. Next is a video of 3 years and 1 month old playing with cylinder pudding. He put in the cylinder with both hands. But both hands are not sufficiently separated. Next is video of 3 years and 5 months old playing with cylinder pudding. He is exploring the hole with his left hand and put in a cylinder with his right hand. Next is discrimination activity period. By the time he was 4, he was able to cooperate with both hands. In the discrimination of shapes, he touched the hole with his left hand, then grasped the object to be inserted with his right hand. In the insert to the cylinder, the left hand explored the hole, and the right hand put the cylinder into the hole touched by the left hand, in order. Here is a video of 4 years old, playing with shape discrimination. Teacher says circle, triangle, rectangles. He finds a hole with left hand and puts in while discriminating with right hand. It's discrimination of cylinder thickness. He's following the hole with left hand. He put in a cylinder with right hand. Next is framed block construction activity period. At the age of 4 years and 5 months, the child became interested in construction tasks. He was seen to accomplish these tasks by trial and error. By the age of 4 years and 7 months, he started to measure the space by hand in the framed block construction task. At the age of 5, he could concentrate on one task for a longer period of time. Here is a video of 4 years and 5 months old playing with framed block puzzle construction task. Child says, how many balls will fit next? Teacher says, next are also 4. He is trying to put in by trial and error. Here is a video of 4 years and 7 months playing with framed block puzzle construction task. He can move the ball to the edge. He can imagine where the ball goes. Here is a video of 5 years old playing with framed block puzzle construction task. Difficult one. He can replace the board at will. Last is free construction activity period. At the age of 5 years and 6 months, he was able to imitate the model of the blocks presented by teacher. He could touch the model, compare and refer. At the age of 6, he was able to trace short lines to long curves, and finally even complex mazes. He was able to count the number of empty space in Braille. Here is a video of 5 years and 6 months playing with cube construction task. This is difficult task. He concentrated on it very much. We believed he could do it. Child said, I've done it. Next is imitation construction with blocks. He touched the model and said 3 blocks. He touched and referenced the model. Here is a video of 6 years old playing with tactile figure with raised line. He touching well with both hands. He said, I found a goal. Next is finding a line of the same length. He touches model and 3 lines. He says the middle line is the same. Next is handmade maze with duct tape. It was very difficult for Tactile to go through the road without tape. We recreated the maze that follows on the tape. He follows well with both hands. Very good. Next is counting an empty space in Braille. he could touch softly, he said for space. Next is discussion. First, I would like to discuss overall development. Until the age of 4 years and 4 months, there was a significant delay from the typical development. On the other hand, after the age of 5 years and 6 months, he was able to do a variety of things rapidly. This suggests that there is a period of slow development in early childhood and that development catches up with a later stage of childhood. This is an imaginary plot of the developmental process of an infant with a disability and a typical development. This suggests that the effect of disability on early development is significant. If we imagine it up to the stage of adulthood, it looks like this. Slowly growing infant. If we compare this to a tree, the roots of the tree grow in the earth. Parallel growth in elementary school. The tree trunk will grow thicker. Catching up in junior high school, the trunk grows upward. From the age of 15 can be as good as a sighted person. The branches and leaves grow. Second, I would like to discuss contents of the activities. It was not that he stopped doing similar activities after the stage, but he continued to work on them from period to period. Even with the same material, child's approaches differ from stage to stage. It is important to work on this continuously. In addition, during the in and out activity, balls, cylinders, and round plates were easy to put in. However, it was difficult to put in square plates, rectangular columns, and triangular columns because they need to be oriented. It was important to consider the different levels of difficulty by making small steps. Third is changes in the use of hand. In the two-handed cooperation, the target child developed from the operating with only one hand. Both hands were working together and not separated. Both hands were becoming separated, and both hands were separated and had different roles. In the construction activities, he was able to make movements such as bring the plate to the edge, measuring space, replace the plate, comparing and referencing. We think that the use of these hands does not come immediately and naturally. They can only be acquired through prior learning. Fourth is verbalization of experience. In the instruction, we verbalize his movements and the state of the teaching tools and put words to his experience so that he could acquire words with real experiences. As a result, the child was able to use correct words connected to the specific situation. This suggests that by verbalizing the target child's condition and putting words to his experiences, he will develop his understanding of language. Lastly, the target child has since enrolled in the elementary school for the blind. He has learned Braille and is able to read and write well. In early childhood, he developed the pleasure of accomplishment and self-confidence through trial and error. This helped him develop an sufficient motivation to touch. We think that experiences in early childhood will become the basis for later learning activities such as learning Braille and orientation and mobility in elementary school and beyond. Thank you very much for your attention.